So for this also, we'd like to invite also Dr. Nabila Almir for this session. Welcome, Dr. Nabila. Now, as I said, our second session will be held by Dr. Hatem Al-Amri. Dr. Hatem Al-Amri currently working as a manager of the Health Professional Licensing Department at the Health Authority, Abu Dhabi. Dr. Al-Amri received the Best Teacher and Best Academic Achievement distinction awarded by King Saud University. Please, Dr. Hatem, take the...
Assalamu alaikum. I think I'll take the opportunity first to thank the organizers for inviting me. Aisha Al-Mahi was forcing me to come, and I think she was successful, and I'm proud to be involved in this. And I think not to take much longer, I will introduce the first speaker. And as being a manager of health professional licensing, so anybody who works in Abu Dhabi, I pretty much know them. So I'll introduce the first speaker, Michelle Machin. I think she is also a member in our examinations and the health authorities. Fatma Al-Hassan actually introduced me earlier on to you. She is basically holding the positions of Director of Nursing Education at the Cleveland Clinic, Abu Dhabi, and she had a vast history and vast experience in medical education and nursing. She has a background in critical care, neurosurgical ICU, holding a bachelor and master degrees from University of South Queensland in Australia, and she's basically an active member in the nursing UAE task force. She's going to talk to us today about identifying the source of evidence and evidence-based nursing practice. Sure.
Good afternoon. Well, I think the first thing we recognize as a group is that we're between you and your lunch. So we'll try and make it as exciting as we can to hold your attention. So I was asked to speak today about identifying sources of evidence-based nursing practice. And I was trying to think of a way that would exemplify how important the source is for evidence-based nursing practice. So I want to just, if you forgive me for 1 second, I want to open up a slide that I had here earlier on. So, I want to know how many of you remember this from your nursing practice. Anybody remember egg white and oxygen on a wound?
Yes.
Yes? Anybody heard of egg white and oxygen? Yeah, some of the English and Irish nurses. So many, many moons ago when I was a student nurse, we would have a lot of elderly patients with leg ulcers. And we had a physician, when I started there, the physician said, put egg white and put egg white on the wound and then blow oxygen onto it. And I said, really? Why would I do that? And he said, oh, it works very, very well. Believe me, I've done it with hundreds of patients here. It works extremely well. So I went, he said, I have the evidence. Hundreds of patients. So I went to the nurse manager and I said, egg white and oxygen? And they said, well, we don't actually put it on. The chief medical officer wants us to put it on, but we actually put saline soaks on. We make him think that it's egg white and oxygen, but we actually all put saline soaks on. So, sort of gives us the idea about what people think is good evidence and what is actual good evidence, and looking for your sources of evidence. So, we'll go back to the main presentation now. Okay, so some of the presenters this morning already gave examples of what is evidence-based nursing practice, and there's many quotes you can see. There's a ton of literature about evidence-based nursing practice. The one I liked the best was the integration of best research evidence with clinical expertise and patient values. Again, this has been spoken about this morning, and I'm just reiterating a lot of what has already been said. It's not just the research, it's also clinical expertise and our patients' values. If we keep the patient at the core of what we're thinking about, we will succeed in our evidence-based nursing practice. But not all evidence is good, remember my CMO. We can also now have the internet. The world is at our fingertips. We have blogs, we have Facebook, we have Wikipedia, there's Twitter. Sometimes there's just too much information, and the information is not good. So, the elements of evidence-based nursing practice, we've already talked about them, include best available evidence, preferences of the clinicians, and nurses' expertise and clinical judgment. But the best available evidence is what we're here to look at in this segment. Potential sources of best available evidence include research by health professionals, research by pharmaceutical companies, reviews of research in clinical literature, expert opinion, the opinions of colleagues, clinical experience, and audit data. These are some of our sources. So one of the areas that I was asked to speak about was the evidence-based pyramid. This was developed by Yale and goes into the hierarchy of evidence, a little bit like the food pyramid, the importance as you move up in the pyramid. So I'm going to break this down and we're going to look at each area of the evidence-based medicine pyramid. So, first of all, the first section you'll see, which is the bottom 4, is unfiltered information. Now this is evidence that's not always available via filtered researches, and it's not always proven in evidence, but yet it's still valuable information. The bottom of the pyramid is background information, looking at evidence from resources, from expert opinion through high levels of evidence. It's people who give their opinion, but it's not scientific. Next is case control studies, or case series and reports. This is evidence. Evidence in these resources vary from expert opinion to high levels of evidence. They are case series and case reports. Moving up the pyramid, we have cohort studies. And a cohort study is a method of research in which a group of patients with a certain diagnosis receive a particular treatment and are followed over time. All of these are very good methods of looking at evidence. Next are randomized controlled trials. These are a gold standard where subjects are randomly broken into 2 groups, those who receive a control and those who don't receive a control. After these 4 basic elements of the pyramid, we're now going to move into filtered information. Now, filtered resources are appraise the quality of studies that they're looking at. So now you're getting into a way more technical and very scientifically appraised form of analysing evidence. There's critically appraised individual articles where authors evaluate and synopsize individual articles that are available in research. There's critically appraised topics, which is a synthesis of all of the articles that are available on a topic. And then there are systematic reviews, which are scientific clinical questions, a comprehensive literature search, and they eliminate poorly done studies. So as we've moved up the pyramid of evidence here, you can see that we've gone from a low level of scientific inquiry of just background information all the way up to a more filtered systematic review. The systematic review can be found in something like the TRIP database, and you can access this if you are interested in research and evidence-based practice. You can access this through tripdatabase.com. It's free to access, free to register for, and what the TRIP database does is simultaneous searches of evidence-based sources and systematic reviews. It looks at practice guidelines, critically appraised topics. It searches Medline and CINAHL. So when you put in a search topic, it will do all of this research for you and bring you out the most scientifically accepted results on that topic. So some tips for finding evidence, and again, a lot of this was talked about this morning. The ideal source of evidence is a systematic review. But I want you to think about what we talked about this morning. A systematic review will give you a summary of a lot of high-quality research studies. What you want to make sure is that you have a mix of quantitative and qualitative. Certainly the medical model was more towards quantitative studies. The nursing model, as discussed this morning, can be towards qualitative studies, and you want to have a good mix. They're your most valid searches that you can do. If it's unfruitful for you to do, you can conduct a search of articles. Librarians, if you have access to a library in your place of work or your school, librarians can be a fabulous source of evidence for you. And then you can go through the hierarchy of evidence. This is the English Evidence-Based Nursing Practice organisation. And again, it categorises evidence into one of 6 levels, from the less scientific views of peers and colleagues, no less valuable but less scientific, all the way up to strong evidence through randomised controlled trials, systematic reviews. Both of these organisations were mentioned this morning. If you're looking for a specialised centre for systematic reviews, then the Cochrane Collaboration is a non-profit organisation with more than 28,000 contributors that will give you accurate information about research and evidence worldwide. The Joanna Briggs Institute is in Australia, in Adelaide, in South Australia, and it collaborates internationally with 70 organisations. The other area that you can get excellent research is through the American Nurses Association. You can go onto their website and into their research toolkit. Once you go to the research toolkit, you can click on Acquiring Information, and it'll bring you to a page that asks you which databases and resources. There's tutorials on this webpage, free tutorials if you're searching for evidence-based information or systematic reviews. There's tutorials on how to search databases appropriately, and then they give you hints and facts and tips and tutorials on appraising evidence, so that you're not looking at one person's single opinion, but in fact you are gathering proper scientific information. It also talks about essential nursing resources and gives you areas that are very key, not for other areas of healthcare, but particularly for nursing. And my last thing is to just say good luck on your search for proper evidence for your research and your evidence-based practice.
Thank you, Michelle. That was actually very much with the time. Actually, it took much less than your time to start. Thank you for that. I think I'll introduce the next speakers, Dr. Salah Aftash. Dr. Salah Aftash basically is a Regional Director of Nursing in Al-Gharbiya Hospital. He has his bachelor degree in nursing from Jordan University, his master's degree of healthcare management in California States, and he had his PhD from UCLA in Los Angeles, and he will talk to us today about the creating culture of evidence-based medicine environment.
Good afternoon. I know I always talk to my people if I give a presentation after lunch that when you come back you normally have the post-lunch syndrome, but I think now we are in the pre-lunch syndrome. So bear with us. First of all, I want just to skim quickly through the objectives for this presentation. But I have some kind of marketing for you. I will be talking about the vision for evidence-based practice. I will be talking about the necessary elements for successful integration of evidence-based practice. I will be talking about how to create an infrastructure for evidence-based practice. And then I will be emphasizing the relationship between evidence-based practice, patient-centered care, and quality care. Now, speaking of Al-Gharbiya, if you don't know, Al-Gharbiya, Abu Dhabi is about 75% of the area of United Arab Emirates. And at the same time, Al-Gharbiya is about 75% of the area of Abu Dhabi. We have 6 or 6 hospitals, I should say. One of them is a secondary care hospital in Medina Zaid. We have one in Liwa, Marfa, Ayati, Ruwais. We don't have any hospital Ruwais, but we have in Dalma and Sila. This is the administration. So through this, that's where I work. And through this administration, we manage all these hospitals as one entity. This shows a picture for Medina Zayed Hospital. Very beautiful scenery, as you can see. This is our Al-Dhafra Family Medical Center. And then some views from Medina Zayed. Don't be deceived with these pictures. This is not in Maldives Island or in Hawaii. This is here in Marfa. So, if you decide one day to come and visit, definitely you will enjoy the beauty of those areas. So you are most welcome to come, and we will be more than happy also to help you out, during your visit. Now, since this morning we'll be talking about, all aspects related to evidence-based practice. We talk about, the PICO, the research question, the research, the blending of all the variables that constitute the essence of evidence-based practice. But believe me, without having a culture for evidence-based practice, everything else is nothing. And sometimes we see nurses, they try to do something on their own, but these are individual efforts. It's not sustainable. Once they leave the facility, they take everything they have done with them. So basically what we need to do is to build as evidence-based practice as a standard, as a culture within the organization. That way, evidence-based practice becomes successful, sustainable, and effective. So why we are talking about evidence-based practice? Because nowadays it's the golden standard in our practice. When we talk about this concept, we ensure the delivery of high-quality care. When we talk about this, we foster outcomes-driven healthcare. This is what the current healthcare system is all about. We are outcome-driven systems now. We will enforce the autonomy of nursing as a profession that appreciates patient health care experience. It is a cost-effective measure. Why? Because we standardize the practice and we will reduce the wide variation in the individual clinician practices. For example, when we develop evidence-based practice as a culture, we think about pathways. We have pathways for acute coronary syndrome. We have pathways for stroke, for instance. All these pathways help us to standardize our practice. And therefore, the outcome for patients is, should be expected to be much better. Now, if you don't know, the Institute of Medicine has set a goal that by 2020, 90% of all healthcare decisions in the United States will be evidence-based practice, or will be based on evidence-based. What does this tell you? If we are talking about 90% in 2020, it means that we are still way behind in our process. Evidence-based evidence indicates that majority of nurses are still not consistently implementing evidence-based practice in clinical settings. Many of nurses, I guarantee you that, they hear about this concept, but when it comes to the practicality of the concept, they don't know what does it mean. So basically, that's an issue, and we will talk about this shortly. There are several initiatives that have been developed to accelerate the use of evidence-based practice by healthcare providers. For instance, we have a system called Pay for Performance program. This system is offer incentives for institutions or facilities for healthcare providers, follows evidence-based guidelines. Many healthcare or health insurance companies, they stop reimbursing hospitals for treating preventable conditions, especially if they are acquired within the hospital. Falls, pressure ulcers, infections, all those conditions are preventable, and the insurers now, they are not paying for that. You should be able to prevent those. So when we talk about a culture of evidence-based practice, we are talking about a culture related to the organization itself, and we are talking about a culture related to the nurses themselves. So when we talk about the organizations, most of our organizations lack the culture that embraces evidence-based practice. There is a failure to recognize the substantial positive effect of evidence-based practice on patient outcomes. Again, we need to adopt that. There is a resistance for change. When we talk about any new practice or any new system to be put in place, there is always resistance. Always we for people in management position or leadership positions, the first thing we consider, how much it's going to cost us, right? How much it's going to cost us. First thing we think about budget and money. The other thing, what kind of resources you need. So when we know that we need a librarian, we need the library, we need computers, we need all these resources, oh my God, this is going to cost us too much. So we stop. Third element, another element, there is differences in our priorities. So evidence-based practice might not be in the top priority for us. There are other things we have to consider. And then there is no clear policy or direction about research utilization. For us nurses, the first thing, we don't have enough knowledge and skills about evidence-based practice. Not only that, we have inadequate familiarity with research utilization. Let me tell you something even more worse than this. I was giving a introduction into research presentation last week, and I asked the audience how many, and probably 75% of them were nurses. I asked them, how many of you took a research course during your undergraduate program? Only 3 raised their hands. So that's an issue. If we don't know what research means, how we are going to understand everything else that follows? So we need to strengthen our academic program and research programs. There is a reluctance to change from traditional practice. We always think about our comfort zones. We don't want to move out of those comfort zones. Nurses' perception for their role. We always feel that we are followers, we are not leaders. We need to change our thinking first before we move forward. We have to think that we are leaders. We can make a difference. We can make a change and move forward with a change. We have an inability to dictate time. People talk about time earlier. You finish your shift, you go home, you are tired. You don't want to do anything. Publishing and presenting research. We do a lot of research, believe me. We have many nurses with PhD degrees, but if you ask them how many of you published your findings, the results are shocking. Results are shocking. Now, let's think about some strategies to deal with all these issues. Number one, for strategies related to organizational or to organizations. Health institution executives need to adopt or establish evidence-based practice as an institutional expectation. They want to build it into their mission, vision, objectives. Also, healthcare organizations, they need to promote culture that supports the importance of evidence-based practice in clinical settings. And executives are expecting outcomes. They need to also to support the measures that will lead to positive outcomes. They need to support all those measures. Also, they need to provide support in terms of infrastructures. For instance, if we need online, there are a need for database. They need to allocate money for that. Libraries, statisticians, mentors, consultants. Also, they may try to adopt or link evidence-based practice, progressive evidence-based practice to promotion and other, processes that help the nurses or empower the nurses to move forward with that. And also, they need to encourage research and conducting research within their facilities. As for us nurses, then we need to, first of all, we need to determine, is the organization that we are working at ready or not to implement evidence-based practice? So we need to think about, maybe we need to conduct something called SWOT analysis. We need to consider the strength and the weaknesses of the institution. We want to know, we want to decide, or we need to decide, is our leadership committed to support us or they are not? So that's something you have to consider. Does the philosophy and mission and vision of the institution support the change process or not? So all these things need to be considered. And finally, another thing we need to consider is the attitude of the staff. I also, from my experience with many nurses in different fields, we always hold negative attitude, and we don't want to move forward. We just want to go to work, we finish our shift and go home and leave me alone after that. We need to get out of this mentality. Don't get me wrong, I'm not trying, I'm not a pessimistic person, but these are incidents I have seen all the time in my practice. So how nurses can create an infrastructure for implementation? We need to promote evidence-based practice within, as an institutional expectation. We need to redesign our policies and procedures to integrate evidence-based practice guidelines. We need to build partnership by developing teams of evidence-based practice and mentors. We need to assign nurses into interdisciplinary committees. We need to be much more involved with this. In Al-Gharbiyya, for instance, recently we established an institutional research ethics committee. I insisted that half of the committee will be nurses. I insisted on that because I want my nurses to be involved and I want them to get exposed to these kind of situations. We need to train our frontline nurses on and provide them with access to library and computers, even in their units. They don't have to go to the library. They need an easy access because they are busy also taking care of their patients. We need to initiate in this interdisciplinary collaboration between nursing staff and other healthcare colleagues. And we need to perform periodic review and evaluation of the progress in the implementation. Evaluation is always important. We need to do that. I'm about to finish, but just when we talk about quality, we always think about the Institute of Medicine pyramid. And as you can see, safety and patient-centeredness are almost taking 50% of this pyramid. So when we focus about outcomes, we always need to consider the nursing-sensitive outcomes. Those outcomes help us focus our attention on the quality of provided care and safety of patients. Some of the outcomes we always need to consider and adopt the evidence-based practice for them include patient-acquired hospital complications such as falls, pressure ulcers, hospital-acquired infection. And also we need to think about our staff and satisfaction and our registered nurses education. Is there a difference between evidence-based practice and patient-centered care? I mean, if you think about the model of the evidence-based practice, it includes patient desires and requirements. So is there a difference? Not much difference. Actually, they are the same. Evidence-based guidelines provide the foundation for patient-centered clinical decision-making. A key component of the evidence-based practice conceptualization is to consider patient values, preferences in the provision of healthcare. So in a patient-centered approach, providers partner with patients and their family members to identify and satisfy the full range of patients' needs and preferences. The process of care delivery, of course, is in need for a major paradigm shift and change in practice. So in conclusion, when thinking about any initiative, we must consider the effect of the extrinsic and intrinsic motivators. Intrinsic motivators has much more influence in changing behaviors and therefore should be the spark that ignites the thinking about evidence-based practice. It has to come from within us nurses. We should not expect that the change will come from outside. It has to come from us nurses first. To thrive in the current healthcare delivery system, nurses must have a never-ending spirit of inquiry that motivates them to consider the evidence that support the current practices. And finally, always think big. Bigger dreams always yield bigger results. And remember to keep your positive belief stronger than your fears. William James was a pragmatic philosopher who said, belief at the beginning of any successful undertaking is the one ingredient that will ensure success. Thank you very much for your listening.
Thank you, Dr. Salah, for your lecture. I think now it's the theory finished, and the next two speakers are going to talk to us about the practicality of putting evidence-based medicine into practice. And I start with Mr. Majid Rashid Al-Muqbali. He's the Director of Nursing and Midwifery Affairs at the Ministry of Health in Sultanate of Oman. He has a master's degree in nursing education from Villanova. That's a hard university to say. He will talk to us about the models to integrate evidence-based into the practice.
respected chairs, Bismillah ar-Rahman ar-Rahim, وبه نستعين والصلاة والسلام على أشرف الأنبياء والمرسلين سيدنا محمد وعلى آله وصحبه أجمعين. Before I start, I would like to extend my gratefulness and thank to the organizing committee, starting from the models to integrate evidence to practice. I hope I'll keep you awake for 15 minutes. I'm going to talk a little bit about the ACE model, the Iowa model, and then a little bit about other models. And then what do we need in GCC countries, what kind of a model we want, and then we will conclude. And everybody today spoke about evidence-based practice, and if you go to any conference, any symposium today in the world, there must be a topic or two about it. And all the curriculums also talk about evidence-based practice, but what it is. And I'm not here to define it, but I'm here to emphasize on the word integration. Integration here means you find best evidences, best researches, best patient values and preferences, expertise from nurses and other allied health and medical practitioners, best clinical judgments. You integrate it all into one evidence, and then you decide as institution or country, not as an individual, as people mentioned, to change the practice using evidence. And the ACE model is one of the models used, but as the previous speaker mentioned, there are so many models. Ultimately, most of them are the same. They differ in some pieces, but at the end they are the same. The ACE STAR model is knowledge transformation, which is conversion of research findings from primary research results. So it's not any research that you find in articles, even if they are scholar articles, secondary references. You talk here about primary research, then you take the findings and then use these as an evidence to change the practice or change the care in your institution. It is called ACE STAR model. It has 5 stages. Starts with discovery.